Switching us here at HCC News from the Center of Disease Control and Prevention states that there has been a case of the Nipa virus here in Houston. For those of us who don't know what the Nipa virus is, Nipa virus or NIV is a bat-borne paramoxyvirus that causes encephalitis in humans and can be transmitted from person to person. As of this moment, there is no known cure for the Nipa virus, which makes this virus a global pandemic threat. We have one of our news reporters, Maria, who's at the Southeast Hospital where the patient is being treated. She's here with Miracle from the CDC and Dr. Kayla, who is currently treating this patient.
I'm here in the Southeast Hospital with Dr. Kayla and a CDC representative. Started with Miracle from the CDC. What can you tell us about this virus?
Well, this virus is a bat-borne virus that has been transmitted from animals to humans, and humans are transmitted from, it's becoming from people to person now. Most of the outbreaks have occurred in Bangladesh and India, and people who are sick with the virus become extremely contagious. There were outbreaks in 1989 and 1999 in Singapore and Malaysia. Since there has been a new strain. The Nipa virus is a very serious virus because there is no cure and in the past 2 years there has been 100% fatality.
What can we do to prevent or minimize risk?
We need to limit the exposure to people who are sick with the virus, especially in the endemic areas. People need to avoid pigs, bats, and other animals that are thought to be sick. People should also treat the drinking water, especially in the affected areas, and also it's important to have surveillance and awareness.
Thank you. And now we're going to Dr. Kayla, who is currently treating the patient. Due to privacy laws, patient cannot be identified. Now, Dr. Kayla, what can you tell us about this patient?
This patient is a 28-year-old female who came from a trip from India, and she was experiencing fevers and she was showing signs of encephalitis, which is swelling of the brain. So after she told us about her trip to India, we decided to get her tested for the Nipa virus, and it came out positive.
How long does it take for symptoms to occur?
It takes 3 to 14 days in order for, after exposure, to show any symptoms.
And what are the symptoms that people can experience?
They can experience fever, headaches, drowsiness, disorientation, encephalitis, and symptoms can progress after 28 to 48 hours. It could cause coma or even death. Patients who do survive this virus have permanent neurological damage, and for surviving patients, the virus can reactivate and can reinfect the patient.
Thank you, Dr. Kayla. This is Maria from HCC News. Now back to you, Verilla.
Thank you, Maria, and thank you viewers for tuning in. I'm Verolia for HCC News. See you guys tomorrow.